The next one is the previously we have seen about the foreign body, ingestion foreign body, aspiration foreign body. Now let us see about the foreign body in nose. Usually in children it is the common thing. The danger of your child putting objects in the nose are more. There is more danger. Children are naturally curious and often wonder how the things work, and usually they display this curiosity by asking questions or by exploring the world around them. And one of the dangers that have occurred as a result of curiosity is that the child will place the foreign objects into the mouth, nose or ears, and while they are harmless this can create choking hazards, and usually the child is in danger of serious injuries or infections. Usually a foreign body in the nose means that the object is present in the nose, and when it does not naturally supposed to be there. The children under the age of 5 often have this issue, usually when they are preschool and school going, but it is not uncommon for the older children to place the foreign bodies in the nostrils. And usually these things are usually clay, food, pebbles, dirt, pad, disc magnets. Before we have seen like button batteries, and these button batteries are found in a watch or of a particular concern. They can cause a serious injury to the nasal passage, and as little as 4 hours. And the paid disc magnets that are sometimes used to attach ears or earrings or nose ring can damage this tissue, and usually they would have occur for over a few weeks. Children often put these objects in the noses or out of their curiosity, and they are mimicking other children. And these objects usually go into the nose while the child is sleeping, or when they try to sniff or smell an object usually. This may be clear, grey or bloody. Discharge may be seen, and nasal drainage will be a bad odor, may be a sign of infection usually. And breathing difficulty will be seen in these children. Child may be difficulty breathing through the affected nostril, and this occurs when the object locks the nostril, making it difficult for air to move through the nasal passage. Child may make whistling noises when breathing through their nose, and a stuck object would cause this noise usually. The clinical manifestations are usually clear, grey or bloody discharge from the nose, and nasal drainage will be of bad odor. It is a sign of infection, and breathing difficulty can be seen out of the affected nostrils, and usually the object will be clogged in the nostril, making it difficult for the air to move through the nasal passage, and child may have whistling noises also through the nostril when breathing through the nose, and a stuck object can be cause this noise. And usually then we have to suspect the child that something is stuck in the nostril, and appointment for the doctor can be taken. And usually the child's nose should be handheld lighted instrument is used to check the nostrils, and usually child's doctor may swab the nasal discharge for the investigation and for the presence of any bacteria, and the primary thing is to remove the object, that is removal of the object from the child's nose. And usually the child may be panic, so we have to the only treatment of this condition is remove the foreign object from the nostril, and in case of in some cases blowing the nose gently may also be necessary to treat this condition. And here there are some tips for the removal of the object, that is try removing the object with tweezers. Only use tweezers or on large objects. Tweezers may be push smaller objects further up the nose, that means using small forceps like objects can be help to remove the stuck object from the nostril. And stop child from sniffing. Sniffing could cause the object to move further up the nose and pose a choking hazard. Encourage child to breathe through their mouth until the object is removed. Go to nearest hospital emergency room or doctor's office if you can't remove the object with the tweezers, and they can have other instruments that can remove the object, and these include the instruments that can help with grass or spoon out of the object. They also have the machines that like a suction to suck the object. And in order to keep the child comfortable, you have to use the topical anesthetic, that is spray or drops into the nose, and which can slightly numb the area. Prior to the removal procedure, you have to apply the drug to prevent the nose bleed, and usually prescribe antibiotics or nasal drops are given to treat or prevent the infection from the nostril. And prevent child from putting foreign objects in the nose, ears or mouth. Sometimes children will misbehave for attention. For this reason, never leave the child alone, and when catch them putting things in their nose, gently explain the child how noses function and why it is bad idea to put things in the nose. Have this conversation every time catch child trying to put things in their nose. That means we have to never leave the child alone, and we have to educate them how the nose works and what is the bad thing idea to keep the things in the nose. Okay, ma, we'll continue in the later session.